What is the most common cause of epistaxis? Nose picking. What is the most serious complication of pharyngitis? Rheumatic fever, glomerulonephritis. What is the most common fatal inherited disease of Caucasians? Cystic fibrosis. What is the most common cause of death in infants 1 to 12 months of age? Sudden infant death syndrome. What is the most common congenital cardiac malformation? Ventricular septal defect. What is the most common cyanotic congenital cardiac disease? Tetralogy of Fallot. What is the most common cyanotic congenital heart disease in the first 24 hours of life? Transposition of the great vessels. What is the most common cause of acute abdominal pain? Acute gastroenteritis. What is the most common cause of endocarditis? Streptococcus viridans. What is the most common cause of acute diarrhea in children? Rotavirus. What is the most common single cause of hypogonadism and infertility? Klinefelter syndrome. What is the most common cause of inherited mental retardation in boys? Fragile X syndrome. What is the best site for assessing the pulse of a child less than 5 years of age? Apical site. What is the most prominent symptom of hydrocephalus? Increase in head size. What is the most common cause of hydrocephalus? Obstruction of cerebrospinal fluid circulation. In a child with hydrocephalus, what is the most appropriate measure to prevent decubitus ulcers on the infant's head? Place a sheepskin under the infant's head. In an infant with hydrocephalus, what is the post-op position of choice after installation of a shunting device? Lay the infant on the side opposite to the incision. What is the most important nursing intervention before giving digoxin? Check apical pulse for 1 minute. What is the best indication of ear pain in a child? Infant pulls on one ear. What is the most appropriate isolation category for a child with chickenpox? Airborne isolation. During early post-burn care for a child, what is the most important thing to monitor? Adequate intravenous fluid therapy. What is the best indication that correct attachment to the breast has occurred? Baby's mouth covers most of the areola. In children with nephrotic syndrome, what is the best indicator of fluid balance? Daily weight monitoring. What is the best method for assessing an infant's response to rehydration therapy? Weighing the infant at the same time daily. What is the most common area for bleeding in a child with hemophilia? Patient's joints. What is the most common cause of perinatal morbidity and mortality? Preterm delivery. What is the most reliable indicator of pain in a child? Changes in behavior. What first activity of daily living should be taught to a developmentally disabled child? Self-feeding. What is the primary nursing goal in a child diagnosed with chronic celiac disease? Lifelong dietary restrictions to prevent dehydration and celiac crisis. What is the most accurate test for confirming a diagnosis of leukemia? Bone marrow aspiration. What is the most appropriate initial nursing action if a child experiences a blood transfusion reaction? Stop the blood transfusion. What sign is most indicative of rheumatic fever? Migrating joint pain.